Hello, everyone, and welcome to the virtual graduation for the University of Saskatchewan's College of Medicine class of 2021. My name is Dominique, and I would first like to begin this day by acknowledging that we have been extremely fortunate to live and learn on traditional Indigenous territories, including Treaty 4 in Regina, Treaty 6 in Saskatoon, and Treaties 8 and 10 in northern Saskatchewan. These treaties encompass the territories of many First Nations in Saskatchewan, including the Cree, Dene, Nakota, Lakota, Saulteaux, and Anishinaabe, as well as the homeland of the Métis Nation. We are all treaty people. We are all responsible for acknowledging the need for truth and reconciliation for the historical and present day injustices and inequities that Indigenous people face in Canada. In the wake of the recent discovery of 215 children buried at a BC residential school, it is especially important that we reaffirm our commitment to truth and reconciliation. As new physicians, we recognize that the role we hold is vital in listening to and uplifting Indigenous voices and supporting sovereignty for all Indigenous peoples. As Senator Murray Sinclair said of the Truth and Reconciliation Commission's work, "We have described for you a mountain. We have shown you the path to the top. We call upon you to do the climbing." Today, I have the great honor of introducing Bob Badger, who is a knowledge keeper from Cockatoos First Nation and will be performing an honor song live from his homelands for us to begin our ceremony. He was born and raised on Keysikus First Nation, where he spent a great deal of time learning from his great-grandparents. Bob has a Bachelor of Indigenous Fine Arts from the First Nations University of Canada and a Master's of Education in Indigenous Language Revitalization from the University of Victoria. As a cultural coordinator for the Office of the Vice Provost Indigenous Engagement, Bob is responsible for walking beside colleges, schools, and units across the university on their indigenization journey. His role is to build cultural capacity and provide guidance to the university community on how to work with elders and knowledge keepers in respectful and meaningful ways, to assist individuals in their understanding of Indigenous cultures, and to teach about the diversity of Indigenous peoples. His elders taught him to be humble and to always be respectful of different cultures. He brings this teaching with him to work every day as he helps to educate the campus community in their indigenization processes. Bob also serves on various committees, including the Anti-Racism and Anti-Oppression Committee, the Buffalo Project, and the Indigenous Advisory Circle. He also presents at various workshops and gatherings and conferences on topics such as traditional storytelling, the history of Indigenous land acknowledgements, working respectfully with elders, knowledge keepers, and language keepers, and cultural responsiveness. He has been providing Indigenous cultural knowledge to the university community for over 9 years and has made many friends along the way. And we are so grateful for his presence today at our graduation ceremonies and for his generous sharing. Thank you, Bob, and I'll send it over to you.
Good afternoon, everyone. I want to welcome you to my home fire. This is my home here on Cockatoos First Nation, and I want to show you around my ceremonial grounds here. So share a song with all of you this afternoon. To pay respects, to you, all 111 of you students that are graduating today. I want to say what an accomplishment. I'm proud of you. And especially, going into your field that you're going into, the field of medicine, and you are all going to carry on, to do great things in your lives. So I wanted to sing this song for you at my home fire here to acknowledge your accomplishments. As Indigenous peoples, we always different events in our lives. So that's what I want to do here for you this afternoon. That you could enjoy yourself. And I want to say congratulations, you did it. You are awesome. You're all beautiful. Thank you.
Thank you so much, Bob, for honoring us today with that song. We are so thankful for your time and the beautiful song you just gave for us. I would also quickly like to thank Val Arnaud-Peltier, who's the Indigenous Coordinator at the College of Medicine. She put down tobacco for us today for our ceremony and also arranged a gift for Bob to thank him for his time to complete this in the most COVID-friendly way possible. And so with that, I will pass the rest of the ceremony over to our lovely MCs, Dr. Fast and Dr. Abelseth.
Ben, are we recording?
We are good to go.
Ben, tell me these things.
Okay, hello everyone, and welcome to the virtual graduation for the class of 2021. We are so excited to have everyone. My name's Ben. I'll be one of your co-MCs.
My name is Hope, but that's Dr. Fast to you now.
We have prepared an amazing presentation because unfortunately we can't get together in person. Be prepared for some speeches, lots of emotion, happy, sad, nostalgia, some fun costume changes. I'm currently wearing my sister's grad cap from 2009. What you can't and shouldn't be prepared for is for me standing up because I'm not wearing any pants.
Great. And first up, to clear that from everyone's mind, we will have the slideshow featuring the class of 2021.
Hello to our class of 2021 MD graduates. Congratulations on your excellent achievement. You have graduated as a medical doctor, and that puts you in a very significant and valued role in our society. As you look back over the past 4 years, you have accomplished many things. You have also handled unforeseen challenges. In years 3 and 4, when your clinical rotations were cut short and your electives were limited to within the province, you showed resilience in these circumstances and have demonstrated you are well positioned to succeed. Take time to celebrate this milestone in your journey and all that you have achieved during your time in the college. I want to stress a few areas that I hope you will think about as you continue on your path, no matter where it leads. The first is leadership. By the very nature of our work, medical doctors are and must be leaders. Your role as a leader in making patient care better is critical. Our healthcare system can only succeed when physicians are engaged in it as leaders. The second thing I would like to stress is apply the important values of honesty, integrity, kindness, and compassion in your role as a physician. Third, remember to be a lifelong learner. It is a necessity for continued success and for serving your patients well. Finally, know that as an MD, you will continue to be challenged and face tough decisions in your career. But you won't face these alone. Build relationships, support those around you. You will be supported in return. I wish each of you all the best of happiness, fulfillment, and success as you begin residency and for the future. We are excited to hear of all that you accomplish in your careers. Please stay in touch. And again, congratulations.
Next up, I'm so excited to introduce someone who demonstrates the importance of teamwork within our College of Medicine. He is the jelly to Dr. Smith's peanut butter.
Yes, this man is the banting to Dr. Smith's best.
He is Kamala Harris to Dr. Smith's Joe Biden.
Absolutely. If you are Aya Amory, he would be considered the mustard to her plain scrambled eggs.
I think we've all guessed who we're talking about. It is our Vice Dean of Education, Dr. Kent Stobart.
Congratulations on your achievement. 4 years of medical school, and you spent the last 14 months of that in a syndemic. That combined cluster of COVID and all the other societal issues that have been happening. I am personally sad not to be able to meet each one of you and to wish you all the best, either through the USask commencement program or afterwards as your family's taking pictures, or at graduation banquet evening. It has truly been an honor to get to know many of you, even through a quick hello or a richer discussion over coffee. Wherever your studies and your career takes you, remember that Saskatchewan is your medicine home. It is where you cut your medical teeth, the place you had the opportunity to listen to someone's complex medical history, to complete that first physical examination, to compose your first real differential diagnosis, to crafting that first cut with a very sharp object. So onwards to your new adventure, and to that I wish you every success. Best wishes.
You know, Ben, when we're thinking about graduation, I've been thinking a lot about our med school experience, and I want to know, did you have any really embarrassing moments in med school?
I think my most embarrassing one was when it was my first day of clerkship and I had written admission orders and I had wrote down an order for IV Tylenol. And the pharmacist called me and super nice about it and was like, you know, I don't know where you've practiced before, probably in another country, but we don't actually have IV Tylenol in Canada. And I totally went along with it. And I was like, yeah, like I didn't even realize, haha, just change it to PO. And yeah, it ended up working out fine. They didn't get some weird IV medication.
Well, I'm sure that you're comforted to know that now you can put Dr. Abel Seth next to those orders.
Yes.
I had a pretty embarrassing moment too. I don't know if anyone in the audience knows what propofol looks like, but it's kind of a milky, chalky substance. It appears that way. And I was on my first day in the ICU, and I saw the propofol hanging next to a bed. And I kind of tapped the bottle and I asked the nurse, "Is this the nutrients for the patient?" And she looked at me and said, "No, that's propofol." And I said, "Great, I'm Hope. I'm the third year medical student on your rotation." So,
even though I think these moments of embarrassment will likely haunt us to the end of our careers, I do think it is our privilege to have been given the opportunity to have these embarrassing moments. And I think we can all thank our amazing teachers for giving us these opportunities.
absolutely. Up next are Conley Kriegler and Balsam Arwini to introduce the teaching awards for the college.
It is with great enthusiasm that myself and Balsam have the honor of announcing what we feel are the most important awards, the Teaching Awards. We could spend hours discussing all the ways amazing teachers have gotten us to where we are today, but for the sake of your time, and as our teachers are constantly telling us to be a bit more concise, truly the best way to say it is thank you. We would not be here if it were not for you and all the teachers who took the time and effort to help us learn and believe we could succeed in a field as challenging as medicine can be. While we try to pretend otherwise, we usually have no idea what is going on, so it's not hyperbole when we say we couldn't have done it without you. So now, without further ado, please join us in recognizing these amazing faculty and residents who truly exemplify what it means to be teachers in medicine. First, please join me in recognizing our Saskatoon Award recipients, Dr. Paul Hayes, Dr. Haven Roy, and Dr. Izan Shahab. Dr. Hayes is a general surgeon in Saskatoon, known for his excellent teaching, sophisticated sense of humor, and an uncanny ability to convince almost anyone that general surgery is more fun and rewarding than sleep. Almost anyone. Dr. Roy is a PGY5 in general surgery in Saskatoon, and in addition to all his free time saving lives and studying for his Royal College, he helped many medical students survive and thrive in their surgical rotations. Lastly, the youthful of the group, Dr. Shahab is a PGY2 in neurology in Saskatoon, and evidently his passion for the brain has translated into helping many medical students understand the giant black box which sits atop our shoulders.
Okay, so let's redirect our focus to what I believe is the best teaching site of all of Saskatchewan, Regina. Not that I'm biased or anything. The recipient of the Regina Faculty Teaching Award goes to Dr. Taylor Beretti. Dr. Beretti is a graduate of the University of Saskatchewan General Surgery Residency Program and has opened up his practice with us not too long ago. He's been a great educator to many of us, particularly those of us who started off clerkship on general surgery, which is not an easy feat. As for our Regina Resident Teaching Awards, we have 3 great recipients. Firstly is Dr. Julie Vermeer, a PGY4 in the Obstetrics and Gynecology program. Julie is known for her bright smile and ability to support her junior learners, especially on those busy labor and delivery nights. Next, we have Dr. Karen Ho, a PGY3 in internal medicine. Truly, the ability to succeed as an internist by knowing just about all of medicine deserves an award in and of itself, but we are excited to thank Dr. Ho in particular for her leadership and help in answering many of our silly questions. Our final wonderful resident teacher from Regina is Dr. Lindsay Richels, a first-year dermatology resident. Dr. Richels is a University of Saskatchewan College of Medicine graduate and has, luckily for us, chosen to train here. As a resident teacher early in her training, her mentoring skills shine through, and we're truly lucky to have her support.
Next, please join me in recognizing our Prince Albert recipients, Dr. James Sampson and Dr. Patrick Luc Laflèche. Dr. Sampson is an emergency medicine physician in Prince Albert, who in addition to teaching many medical students about the wonders of emergency medicine, he has convinced at least one of our classmates to pursue a career in emergency medicine as well. While Dr. Laflèche is currently in Inuvik working as a GP surgeon, before he left, he taught many medical students while completing an enhanced surgical skills residency in Prince Albert.
Our Saskatchewan Longitudinal Integrated Clerkship, or SLIC sites, continue to grow throughout our province, offering students comprehensive and unique training at rural centers in Saskatchewan throughout their 3rd year of medicine. We'd like to thank Dr. Reed Gillanders for his support and skills in teaching our students. Dr. Gillanders is a family physician and a University of Saskatchewan graduate who practices in Meadow Lake. We'd also like to congratulate Dr. Andre Babkis, a family physician and anesthesiologist working at Esteban St. Joseph's Hospital. The ability to grow skills in a variety of specialties simultaneously is a considerable challenge, but thankfully, with the great support from our fantastic educators throughout the province, Saskatchewan students succeed. Conley and I, on behalf of the class of 2021, wanted to thank the recipients of the Teaching Awards, as well as all of our educators and mentors who've supported us throughout these past 4 years. You've all watched us grow from being cautious first years stumbling to take a blood pressure, to nervous third years lost in the hospital, to somehow competent fourth years who are currently thinking, is it really possible that I have an MD right now? Actually, yes, it is possible, thanks to our lovely University of Saskatchewan faculty. Congratulations to everybody, and thank you all so much.
I don't know where my co-host went, so I'm just going to go ahead and present the next speaker, who is Dr. Meredith McKeag, and she will be presenting the academic awards.
Ooh, one of the awards is Spirit of the Class. Ooh, we couldn't think of any other joke. Spooky. Ooh.
Great. Thank you for that, Ben. Yeah, what he just said. Everybody, please put your hands together for Dr. Meredith McKeag.
Ooh, ghost clap.
Hi, my name is Meredith McKeag, and I'm your Associate Dean for Undergraduate Education. I'd like to offer my warmest congratulations to the class of 2021. I wish we were together in person, enjoying pierogies and cabbage rolls at Prairieland Park. However, I would like to thank and congratulate your grad committee on preparing the next best thing. And so in honor of the occasion, I have temporarily taken off my slippers, put on my high heels, gotten dressed up, and am very pleased to take part in your celebration. Before I announce the award winners, I'd like to make a few brief acknowledgements. I had the honor of becoming your Associate Dean in September of 2020, 6 months into the pandemic. Prior to that, for the first 3 years of your program, Dr. Pat Blakely was your Associate Dean. I'd like to thank Dr. Blakely for her very hard work for the students that marked her time as Associate Dean. During her tenure, among other things, we introduced a new curriculum and had a very successful accreditation under her leadership. And she led effectively through both these processes, as well as through those first intense few months of the pandemic. I'd also like to thank and acknowledge Dr. Tom Smith-Windsor, who's our Associate Dean for Distributed Medical Education and who's retiring at the end of this month. Dr. Smith-Windsor has been a strong advocate for developing the Prince Albert campus and the SLIC sites where many of you enjoyed your education. So thank you so much to Dr. Smith-Windsor. I'd also like to acknowledge the undergrad administrative team around the province for their incredibly hard work. They always go above and beyond, but they were asked to do that again and again over the last year to meet the challenges and changes presented by the pandemic. In addition, our faculty and our educational leadership have shown immense dedication in helping students to continue to learn despite the challenges of the pandemic. Finally, and most importantly, I would like to thank the class of 2021. You've been an amazing group of students to work with, and you've shown a huge amount of maturity, resilience, and adaptability over the past year. You've shown great commitment to your own learning and development as professionals. I know that for each of you, there have probably been challenging times during your MD program, as well as a lot of rewarding and fulfilling times, just as there will be ahead of you in your challenging, rewarding, and fulfilling career. And so on to our College of Medicine Awards, which celebrate particular achievements of the class of 2021. I will share a brief award description and introduce each award recipient. There's no need to hold your applause until the end, and so I'd encourage you to just go for it and clap and cheer as loudly as you would like to wherever you are. The Dr. Vince Matthews Prize in Community Health and Epidemiology is named in honor of Dr. Matthews, who was professor and head of the Department of Social and Preventative Medicine, now CH&E. He had a distinguished career in public service, including being acting Deputy Minister of Health in 1962 when Medicare was introduced in Saskatchewan. He retired in '87 and passed away in 1988. The recipient of the Dr. Vince Matthews Prize in Community Health and Epidemiology is Dr. Carl Van Tom. Carl will be going to do internal medicine in Regina. The Dr. G. Ernest McBrien Award is in memory of Dr. G. Ernest McBrien, contributed by Mrs. Madeline Smith. It is awarded to the medical student with the highest standing in family medicine and who plans to pursue a career in family medicine. The Dr. G. Ernest McBrien Award goes to Dr. Dakota Van Dyck, who will be doing family medicine in Saskatoon. The Lawrence and Penny Klein Scholarship in Palliative Care recognizes a final year student who's demonstrated the potential and interest to pursue a career in or related to palliative care. The Lawrence and Penny Klein Scholarship in Palliative Care goes to Dr. Sidra Hawk, who will be doing family medicine in Regina. The Hilliard Silver Medal and Department of Medicine Prize honors the first professor of medicine at the U of S and is awarded to a graduating student on the basis of excellent performance in clinical medicine and the Foundations course. The Hilliard Silver Medal and Department of Medicine Prize goes to Dr. Amanda Ames, who will be doing internal medicine in Vancouver. The Dr. Eric Lepp Memorial Award in Medicine is awarded in honor of Dr. Lepp, a nuclear medicine specialist in Regina who was killed in a car accident in 1990. In his honor, this award is presented to the student receiving the highest mark on the internal medicine rotation during clerkship. The Dr. Eric Lepp Memorial Award in Medicine goes to Dr. Leah Rusnell, who will be doing obstetrics and gynecology in Calgary. The Dr. Vernon and Mrs. Christine Hepner Award for Excellence in Internal Medicine recognizes students with the best performance in internal medicine who are being matched to an internal medicine residency, one in province and one out of province. The Dr. Vernon and Mrs. Christine Hepner Awards for Excellence in Internal Medicine go to Dr. Christopher Ripplinger, who will be doing internal medicine in Saskatoon, and Dr. Amanda Ames. The Department of Pediatrics Prize is presented to the student with the best overall performance in their pediatric rotation. The Department of Pediatrics Prize goes to Dr. Zachary Hushi, who will be doing internal medicine in Saskatoon. The J.W. Gerard Prize in Clinical Pediatrics honors Dr. Gerard's lifelong commitment to the care of children and excellence in clinical pediatrics, and is awarded to the most distinguished graduating student in clinical pediatrics. The Dr. J.W. Gerard Prize in Clinical Pediatrics goes to Dr. Shane Layan, who will be doing anesthesiology in Saskatoon. The Professor Popkin Prize in Obstetrics and Gynecology is awarded to a student who, during clinical clerkship, demonstrates superiority in acquisition of knowledge, skills, values, and attitudes that physicians need to provide reproductive health care. The Professor Popkin Prize in Obstetrics and Gynecology goes to Dr. Amanda Hondel, who will be doing family medicine in Moose Jaw. The Obstetrics and Gynecology Silver Medal is awarded annually to a final year student with best performance in the O&G rotation. The Obstetrics and Gynecology Silver Medal goes this year to Dr. Leah Rusnell. The Physical Medicine and Rehabilitation Prize, sponsored by the RUH Foundation, is presented to the student who has shown outstanding academic achievement and clinical performance in the area of physical and rehabilitative medicine. And the Physical Medicine and Rehab Prize this year goes to Dr. Aidan Ma, who will be doing family medicine in Saskatoon. The Henry and Cheryl Kloppenberg Prize in Psychiatry is awarded to the student ranking highest in their psychiatry rotation in clerkship. It recognizes the Kloppenbergs' long-standing interest in supporting the pursuit of excellence in psychiatric care. The Henry and Cheryl Kloppenberg Prize in Psychiatry goes this year to Dr. Emmett Hayes, who will be doing orthopedic surgery in Ottawa. The Carl E. Oberdiek Prize is given to the student who attains the second highest mark in clinical psychiatry in clerkship. The Carl E. Oberdiek Prize this year goes to Dr. Veronica Hammer, who will be doing internal medicine in Calgary. The Beatty Award in Psychiatry was established in memory of Dr. Beatty, a prominent psychiatrist in Regina. This award is presented to the medical student who completed the psychiatry portion of their clinical clerkship in Regina. The Beatty Award in Psychiatry goes to Dr. Jordan Kemp, who will be doing psychiatry in Regina. The Saskatchewan Psychiatry Association Award goes to the student with the top academic achievement in their psychiatry rotation. And this year, the Saskatchewan Psychiatry Association Award goes to Dr. Emmett Hayes. The Hugh MacLean Prize and Silver Medal in Surgery is donated by Dr. J.B. Ritchie, who was associated for many years with the late Dr. MacLean in surgery in Regina. It's donated to go to the student who shows the highest proficiency in surgery. And the Hugh MacLean Prize and Silver Medal in Surgery this year goes to Dr. Conley Kriegler, who's going to be doing radiation oncology in Edmonton. The Professor's Prize in Surgery, given by the professors in the Department of Surgery, goes to the graduating students who've shown the greatest promise as a future clinical surgeon. It's awarded on the basis of excellence in clinical performance and oral examination. And the Professor's Prize in Surgery goes to Dr. Robert Bigsby, who will be doing cardiac surgery in Ottawa. The Emergency Medicine Book Prize is actually two prizes, one to a student in Regina and one in Saskatoon, who have the top clinical performance in their emergency medicine rotations. The Emergency Medicine Book Prize goes to Dr. Leah Resnell in Regina and Dr. Andrew Tolney, who will be doing emergency medicine in Saskatoon. The Robert G. Murray Undergraduate Award in Medicine is awarded in memory of the former Dean of the College of Medicine and provides financial support to an undergrad student who completed their grade 12 education in the province and who intends to establish a family medicine practice in the province. The Robert G. Murray Undergraduate Award in Medicine goes to Dr. Helen Tang, who's going to be doing family medicine in Kelowna. The Doctors Epstein and Schnur Award in Integrative Medicine, in honor of Doctors Epstein and Schnur, is provided to a student in recognition of demonstrated motivation, initiative, and achievement in integrative medicine. The Doctors Epstein and Schnur Award in Integrative Medicine will go to Dr. Shane Layen. The Reuben Brandt Scholarship in Medicine for overall academic achievement is awarded to the student in the graduating class with the most outstanding overall academic achievement in their 4 years of undergraduate medical education. And this year, the Reuben Brandt Scholarship in Medicine for overall academic achievement goes to Dr. Amanda Ames. The Reuben Brandt Scholarship in Medicine for Academic Achievement in Year 4 recognizes the student with the highest overall average in Year 4. And this year, the Reuben Brandt Scholarship for Academic Achievement in Year 4 will go to Dr. Laura Neuberger. Laura will be doing diagnostic radiology in Calgary. The Doctors Ivan Jen and Suzanne Yip Award is presented annually to the student who achieves the highest average in all courses related to student-patient interactions and the refinement of their basic clinical skills. The Doctors Ivan Jen and Suzanne Yip Award will go to Dr. Amanda Ames. The James Walker Wood Award in Medicine recognizes a student entering the first year of a residency program in family medicine with a preference for students who demonstrate an interest in rural family medicine. And the James Walker Wood Award in Medicine this year will go to Dr. Caitlin Schick, who's doing family medicine in Prince Albert. The Saskatoon Plainsman Club Award in Family Medicine is given by the Plainsman Club, a non-profit group made of local representatives from innovative pharmaceutical companies currently operating in the Northern Saskatchewan Territory. This award goes to a fourth-year student who is from and intends to establish a family medicine practice in Saskatchewan. And this year, the Saskatoon Plainsman Club Award in Family Medicine goes to Dr. Kate Morrison, who's doing family medicine in Saskatoon. The Walter J. Hayter Scholarship in Medicine is granted to a student in the graduating class who's matched in physical medicine and rehabilitation. And the Walter J. Hayter Scholarship in Medicine goes to Dr. Joel Peltonen, who's doing physical med and rehab in Saskatoon. The John T. Sibley Bursary is in honor of Dr. John T. Sibley, former professor of rheumatology and immunology in the College of Medicine, as well as gifts from family, friends, and colleagues. This award is granted to a student who plans to establish a practice in Saskatchewan following their residency training. The Dr. John T. Sibley Bursary goes to Dr. James Hill, who is doing internal medicine in Regina. The MacLeod Silver Medal is named in honor of Dr. Wendell MacLeod, second Dean of Medicine from 1952 to 1961. The Silver Medal is awarded to a student whose scholastic work and extracurricular activities are outstanding. The MacLeod Silver Medal this year goes to Dr. Laura Neuberger. And the Lindsay Gold Medal honors Dr. W. Stewart Lindsay, first professor of pathology and the first dean of the School of Medical Sciences. It is an award that goes to the graduating student with the most outstanding academic achievement in each year of training in the College of Medicine. This year's Lindsay Gold Medalist is Dr. Amanda Ames. We have two final and very important awards. The Spirit of the Class Award, given by the College of Medicine Alumni Association, was first presented in 1985. This award fulfills the Alumni Association's wish to honor the graduating class, and especially the member of the class who epitomizes the spirit of the class during their 4 years of medicine. And for 2021, the Spirit of the Class Award goes to Dr. Kate Morrison. Kate's classmates made some of the following comments about her in relation to this award. Kate consistently went above and beyond to coordinate events and opportunities for the class. She organized and advocated on our behalf countless times and is someone who's a friend to all. There's no one else I would rather have lead our class through a tumultuous medical school experience than Kate. She represented our class with grace, humility, and the appropriate level of assertiveness. She was involved in many additional committees and volunteer opportunities, such as fundraising for LaLoche amid the COVID outbreak. She was a great leader and a friend to all of our classmates. Congratulations, Kate. The Senior Stick Award goes to a graduating student who has made a significant contribution to the social dynamic of the class and supported the development of a strong class bond. And for 2021, your Senior Stick is Dr. Ben Abelseth. Ben's colleagues shared the following about him. Ben has been involved in our class's activities and advocacy throughout medical school. He held the role of VP Regina on the SMSS in second year and has been a class rep for year 3 and 4. Not only has Ben taken on these roles of student advocacy and leadership, but he's taken an active role to start an LGBTQ safe space set of health talks for students and faculty, helped to organize student experiences in Regina, and spearheaded the yearbook development for our graduating class. Ben will be going to Calgary to do anesthesia. Congratulations, Ben. That's our last award, so please join me in congratulating all the award winners and everyone in the class of 2021. Graduates, as you go forward to start this next stage of your career, we send with you our warmest wishes. We know that you'll practice both with humility and also that you'll have the confidence to know that you have much to offer your patients and your community. Thank you.
Congratulations, class of 2021.
We wish
You
all
the best in the future.
from the College of Medicine.
Yay!
Congratulations. Best of luck. Woohoo!
To the graduating class of 2021, I'm Dr. Bargava.
Vanessa Heinmarsh.
Carolyn Leschke.
Shannon Bay.
I wish for you a very bright future full of success and accomplishments. I have full faith that being a U of S grad, you will enter the world of residency with a great sense of confidence and knowledge. The Department of Obstetrics and Gynecology wishes you all the very best in your endeavors and future deliveries. Yay!
Congratulations, class of 2021.
Hi, class of 2021. We really enjoyed working with you and we wish you the very best in your future endeavors.
Congratulations.
Hi, grads of 2021. It's your clerkship team. We just wanted to tell you that an extra special congratulations from us. What with COVID and everything, it's been a crazy ride and you all did so amazing. We're so incredibly proud of you. Congratulations.
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 Congratulations, class of 2021.
We wish you all the best in the future.
Yay!
Yay!
Next up, I'm so excited to introduce the presenters for the College of Medicine Alumni Association Awards.
Yes, the Alumni Association does so much for us students. They make our call shifts a lot better by supplying snacks for late nights and early mornings in our student lounge. Somehow they always get popcorn to all of our events, and I know that that is a class favorite. And most importantly, they provide funding and networking opportunities for the students in our class. So I'm really excited to introduce the first speaker, Dr. Terry Zlipko. He is part of the class of 1974.
And following that, Mr. Derek Thiessen from the Alumni Association will introduce another award.
Dear graduates, the College of Medicine Alumni Association extends sincere congratulations to the class of 2021. Today is the culmination of years of arduous learning, of being committed and dedicated to the achievement of your goal. The past 12 months have been unlike anything the College of Medicine has faced in its history. You displayed strength, resilience, perseverance in the face of the challenges that COVID presented. These attributes will serve you well as you embark on your journey as practicing physicians. The College of Medicine Alumni Association is extremely proud of your achievements. It is important to remember that learning continues. Realize that whatever you choose, wherever you go, you have the potential and obligation to effect change for those in your care. Equip yourself with humility, dedication, sympathy, empathy, integrity, and the joy of knowing and understanding that you have the ability to impact the lives you touch. You now join a proud network of over 3,500 alumni. By becoming alumni of the College of Medicine, you are now an extension of the strong tradition of excellence, professionalism, integrity, and generosity. You are what the world needs. Upon graduation, you will receive a complimentary 1-year membership for the College of Medicine Alumni Association, providing you with heightened opportunities to reunite with classmates, connect with the College of Medicine, and provide critical support for the next generation of medical students. The College of Medicine Alumni Association warmly welcomes you to our alumni community. We encourage you to take advantage of your membership over the next 12 months and become active members of the Alumni Association. You may reach to your College of Medicine alumni office. They will provide you with valuable information to remain involved and connected. Believe in yourself. There is much you can achieve. You have something good to give. You can make the world a better place to live. Your talents and skills are needed. Wish, dream, find happiness, be inspired to succeed. Once again, please accept our sincere congratulations, class of 2021.
Congratulations, class of 2021. All of your hard work has paid off. The entire College of Medicine is proud of you. As the Alumni Relations Officer in the College of Medicine, I want to offer you my sincere congratulations, and I look forward to connecting with each of you as an alumni of the College of Medicine. Each year, the Alumni Association gives a graduation frame to a lucky winner in the graduating class. In 2021, we are pleased to announce that Joel Peltonen has been randomly selected to receive this gift. Congratulations, Joel. Alumni Relations will reach out to you and arrange for you to receive your frame. Once again, congratulations to the entire class of 2021. on your extraordinary accomplishment. The entire Alumni Association is excited about welcoming you into the alumni community.
We are very lucky to introduce our next speaker, who is the keynote speaker for tonight, Dr. Susan Shaw.
Dr. Shaw completed her medical degree and anesthesiology residence training at the University of Saskatchewan College of Medicine. After completing her critical medicine fellowship at Stanford University, she returned to Saskatoon to work as an anesthesiologist, critical care physician, department head, and system leader. Dr. Shaw is currently the Chief Medical Officer of the Saskatchewan Health Authority and Board Chair of the Saskatchewan Health Quality Council. She lives in Saskatoon with her family.
Dr. Susan Shaw is one of the many brave faces of the COVID-19 pandemic who is fighting on the front lines for our city and our province. So we are very honored to have her here tonight to speak. Please give a warm welcome for Dr. Susan Shaw.
Distinguished guests and graduates, what an honor to be with you here today. I think we are pretty much all at the point where there really isn't anything unusual about celebrating such a landmark occasion, your graduation from our medical school by Zoom. This may actually be the most fitting way to cap off what has certainly been an unusual past year and a half, but I must say I would much rather be with you in person to celebrate your success and this milestone in your life. No matter the method or technology supporting this ceremony, and no matter how much of our world is different right now, your graduation is, at its heart, the same as the other convocations that have preceded it from this College of Medicine over the past almost 100 years. You have achieved your Doctorate of Medicine and the privilege of carrying with you the designation of Doctor. And you are now heading into what is an even more transformative journey as you start your residency training and are closer to achieving professional independence and responsibility. Independence, but not isolation. While you are graduating, ideally in small bubbles across Saskatchewan and likely across our country, you are part of a much larger community. Welcome to our profession. You have spent the past 4 years studying to complete your degree, but it is the last 16 months which you have asked me to reflect on, which have had more than their fair share of uncertainty, fear, and anxiety for most, if not all of us. Life as we knew it was disrupted when the pandemic was declared by the World Health Organization on March 11th, 2020. And it was the very next day that the first person in Saskatchewan was diagnosed with COVID-19. Over a year later, we are still in that state of emergency that was declared on March 18th. And your in-person medical training was interrupted. Your dean, faculty, and staff have all been ensuring your safety while maximizing your ability to continue to progress through your medical training. Like most solutions to complex challenges, collaboration across institutions and across the country was required. I'm grateful for the efforts of many. I'm proud to have been a small part in helping find the way forward as you worked so hard to complete your medical training. Much of the past 16 months has been so different than any of us could have imagined or planned. Along with consolidating your knowledge while gaining clinical experience, clerkship is also about exploring career paths and options. This too was dramatically altered when out-of-province travel, training, site visits, and in-person interviews all disappeared. And you found your way, and you made it through. We've all lived our own version of this pandemic, and so in preparing for this talk, I reached out to some of you to learn more about how the pandemic changed things and changed you. Some of you shared that when you first learned you had a couple of unplanned weeks off, you really embraced the opportunity to have time to rest, relax, and actually be off. This isn't something that often happens in a life of medicine, and I encourage you to continue to learn how to disconnect and rest, something that I'm continuing to work on myself. For many of you, the loss of rhythm and routine of clerkship was also accompanied with a sense of uncertainty amplified by the news stories arriving from both near and far parts of our world. Trying to make sense and find a path within rapidly changing and incomplete information is what we as physicians are constantly asked to do. So keep growing this skill, and it will serve both you and your patients well. You also described additional lessons that built on the ones traditionally taught in medical school at the bedside or in small group teaching sessions. You learned and confirmed what you value and what fulfills you. The importance of a sense of purpose, a need to be connected and part of something greater than yourself. And you learned that there are so many other ways to fulfill this innate drive beyond being in the clinic or on the wards. Many of you created or found your own way to be part of the pandemic response. You confirmed that the role of the student always includes the ability to truly be of service. Being part of the greater community creates certainty, helps make sense within the confusion, and fulfills our individual need to connect. Some of you volunteered with the Student Senior Isolation Prevention Program, reaching out to older adults through weekly check-ins, which some of you still continue. You made hundreds of negative callbacks to people anxiously waiting on their COVID test results, and you actively helped contact trace. Through this chance to connect and serve, you heard stories and offered comfort and connection alongside reassurance and information. You gained hands-on understanding of the importance of public health, an invaluable service line that before the pandemic was invisible to so many of us. You even provided childcare and supports to health and care workers who no longer had the option of daycare. And you raised thousands of dollars and sourced and sent much needed supplies to remote communities, including La Loche. You asked and found ways to answer the fundamental questions at the heart of our chosen profession. How can I help? What can I do? Throughout the years of medicine to come, do not lose sight of these two questions, which can ground you and remind you of the why, the purpose that you can fulfill. The pandemic also made much more visible our biases and mental models, the inequities that come from our shared history, and our blind spots. The strengths and weaknesses of a healthcare system that too often works downstream and can only address a small subset of what actually creates health and wellness. Any doubts that any of us may have had about the absolute importance of prevention should now be gone. Pay attention to this lesson. Ask yourself what you can do to work upstream to improve health and wellness for the people you serve. All of you spontaneously spoke to me about the gratitude you have for being on your career path, for having supports, for being part of a college and community that looks out for one another. Many of you, but not all, even spoke to the surprise benefits of being forced into a bubble and reconnected with family, something that doesn't often happen as we launch and grow as adults. From the moment we get up to the moment we lay down to try to rest, all of us have been surrounded by more numbers coming at us all the time. How many tests, new diagnoses, deaths, and now, thankfully, vaccines. It is so much easier to talk about numbers and rates, but do not get trapped in the numbers game. Do not forget that every case counted is a person, someone's family, somebody's neighbor, members of our community. Continue to pay attention to this as you enter residency and then practice. Guard yourself from thinking and talking about the brain tumor in room 502. Instead, think, talk, and care for the 76-year-old former school teacher who loves to garden and is scared about his future. And where there is fear, there is the opportunity to provide comfort. What a privilege we hold. Within all this disruption is opportunity. Throughout your 4 years at the college, you made most of the opportunities presented to you, and you looked for and found the opportunities and the hidden lessons throughout this past 16 months. Carry this forward with you into your years ahead. Always focus not on what you have lost, but what you could gain. Find the opportunity. Listen to what you are learning about yourself and the world within which you live. Our alma mater, the the University of Saskatchewan has a fantastic campaign slogan, "Be what the world needs." I think about this phrase often, particularly as we now all look ahead. I'm looking ahead to what the world, or at least my part of the world, our province needs as we work towards recovery and then renewal of our healthcare system and society. You are all also looking ahead to the adventures, lessons, and growth that will come to all of you as you start off on this next phase of your personal and professional development. So congratulations to each and every one of you. I wish you nothing but the absolute best as you take your next steps along your career path and journey. Your time at this great college, your efforts, your teachers and support crew, your family and friends have all prepared you so well. The pandemic itself is part of this story and has helped you learn more about who you are and how you will become your best version of you. So stay safe, stay connected, and stay kind. Thank you.
Up next, I am very excited to introduce Amy Short and Amay Prefontaine, who are going to be giving the toast to the families. This is a very important toast because our families have given us so much support. So I splurged and got a crystallized bottle of champagne. Ben, catch!
Wow, I'm glad you caught that, Ben. Very grateful because I splurged for a glass quart.
Oh my gosh, it's so beautiful. And what technical skill to shoot it all the way over here. I just wanted to take a moment to say that as a class rep, I feel like I've had the privilege of getting to know all the grads. And I had one thing that I really wanted to say to the families, which was I will be sending you my therapy bill. So please give a warm welcome to Amy and Amay.
Bonjour et bienvenue. Tanse Tawau. Good afternoon, esteemed colleagues, faculty, family, and friends. As we join to celebrate today, we take a moment to acknowledge the treaty territories that we are on. We pay our respects to the First Nation and Métis ancestors of this land, and we reaffirm our relationship with one another. My name is Amay Prefontaine, and this is Amy Short. As representatives of the graduating class of 2021, we are honored to present our collective gratitude to the exceptional people in our lives that we are privileged to call family and friends. You know who you are.
4 years. Where does the time go? This rhetorical question often garners a mixed response from the medical students of the class of 2021. On one hand, it seems like yesterday when we all convened in room E1130 for a 3-day orientation for what would become the gateway to the last 4 years. Yet over that time, lifelong friendships were made, cadavers were dissected, countless assignments and exams completed, another OSCE checked off, numerous call shifts juggled, rotations and electives coordinated, and then sprinkle in the pandemic to cap it all off, and here we are today. But to think that we were alone in this endeavor would be a gross underestimation of the success of each and every candidate here right now.
So to our parents, siblings, grandparents, partners, friends, and to our children, we could not have done this without the significant and under-recognized support that you provided to each and every one of us throughout the course of medical school. Moreover, we have appreciated your endless number of good luck wishes you have shared throughout the years leading up to medical school. However, how we became first medical students and now residents had nothing to do with luck and had everything to do with the people you have shaped us to be. Whether it was your genetics that got us through immunology, your unfaltering love and guidance, your example of hard work and perseverance despite setbacks or challenges, or your compassion and kindness that you share selflessly. You are fundamental to who we are as people and who we will be as physicians.
Among the hustle and bustle of the last 4 years and many of its triumphs, there were admittedly days of high anxiety, frustration, fatigue, and uncertainty. There are certain personality traits that a career in medicine seems to elicit. These are often described as type A personality traits. While there are positive aspects such as self-discipline and high achievement, there is also another less desirable side. The difficulty of accepting failure and harsh self-criticism are just 2 examples that can be devastating. We are so grateful for the times that you believed in us, even when we lost faith in ourselves. We thank you for providing the much-needed grounding, for picking up the pieces during times when confidence was shattered, and for rebuilding it. You affirmed to us that not only could we do this, but that yes, there is life beyond medical school, reminding us to leave the white coat at the door. You added that much-needed reassurance and redirection to what is truly important, the importance of humility and the privilege to serve others. For many of us, you were key to the balance that is such a significant part of our success.
There are times at the dinner table or phone calls or Zoom chats when our discussions were taken over by our stories of weird and wonderful medical cases, the delivery of the first child delivery, draining abscesses, suturing lacerations, or how the nurses saved us once again. And who would have guessed that our acceptance into medical school would require you to learn a new language, just so you could understand our long-winded rants about OSCEs, MedSoc, CanMeds, NBMEs, DSBs, CARMs, and the MCCQE. But you were there.
There were first days of school, engagements, weddings, and the welcoming of babies. There were times when we'd have to leave early from a family celebration or even miss it altogether to prepare for an exam. Perhaps we would sacrifice attending a child's baseball game or would have to say bye for now to a distanced loved one too many times. Or times we'd ask for last-minute pinch-hitting help if we could not meet our family obligations. You were there.
For the times that you restocked the fridge, provided a safe vehicle to travel with, sent money, or made sure to have a warm meal ready when we returned home from school, we thank you.
For the times you picked up kids from school when best laid plans fell through, or saved the day by playing with them when we could not, we are grateful.
For the times that you celebrated our triumphs and supported our low points just by your presence, or by a much appreciated text, we thank you.
We could not have done this without you. You have given us so much more than what has already been mentioned. A degree in medicine really is a we endeavor. Life allows us opportunities that are often much bigger than what we can handle on our own. But when we take the time to reflect on the past 4 years, the path is clearly one that was not taken alone.
So please join us in raising your glasses to toast our unsung heroes, our families and friends for all the support that they have provided so that we could chase this dream.
To our family and friends.
Next up, I'm so excited to introduce Cation Aravinson and Samuel Malot-Toker, who will be giving the toast to the faculty. This equally important toast calls for an equally important celebration. Unfortunately, I couldn't splurge for champagne, but I did get a piece of toast. So here, Hope, catch. And I splurged for whole wheat.
Wow, thank you so much, Ben. Just perfectly toasted. There you go. Please give a warm welcome to Sam and Cation.
Good afternoon, everyone, and thank you for joining us today to celebrate our graduation. My name is Cation.
And I'm Sam.
And today we have been given the opportunity and the privilege to speak on behalf of our class about the amazing faculty we have here at the College of Medicine. From lecturers to clinical educators and faculty leadership, it can be a thankless job at times. But we know that without their expert knowledge, compassion, support, and tireless efforts, none of this would have been possible.
Being involved in the college means taking on the unique and immense responsibility of training the next generation of physicians. And the weight of this is sometimes lost on us students who may, in the face of tough exams, busy rotations, and more recently residency applications, lose sight of the big picture at times. Not only are the faculty responsible for teaching us the scientific foundations of medicine, but it's also their duty to ensure that we will be safe, caring, and culturally competent practitioners in our eventual communities.
Essentially, they have to train us to the level that they would feel comfortable with entrusting the care of their loved ones to us. And that's not an easy task. And many of our faculty do this while also carrying a full patient load, teaching courses, contributing to curriculum design, sitting on multiple committees, and conducting research or more. It sounds exhausting, but they do all of this with a smile on their faces.
And that's all in a normal year. I think it goes without saying that this past year posed some additional, one might say unprecedented challenges, but our faculty went to bat for us every single step of the way, and they did their best to ensure that the pandemic didn't completely derail our education. With our best interests in mind, they quickly pivoted to online lectures, modified rotation schedules, virtual assessments, and here we are now, successfully on the other side.
On top of being our educators, many of the college faculty have also become our role models and our mentors. They've taken us under their wings and shown us the ins and outs of their respective specialties, and along the way, influenced many of our career paths. I know that I came into medicine thinking that I wanted to do one thing and have completely changed trajectories because of the role models and mentors that I had. The importance of these professional relationships cannot be overstated. At one point or another, I think we've all experienced that moment where you just click with someone and it makes you rethink your whole plan. I jokingly think about the time that I was on obstetrics and gynecology in Regina, and the amazing relationships and experience I had with the faculty here made me almost reconsider whether I wanted to do ENT and consider obs-gyn. As you all know, I did eventually choose to continue to just stay above the clavicle. But this experience, I think, speaks to the power of mentorship and the power of the relationships that we have with our faculty.
Definitely. There were also a few times where I envisioned completely different lives for myself, simply based on great interactions with various faculty across a whole bunch of different specialties. And that's actually a unique feature of our medical community that I'm really grateful for. As the only medical school in the province, we benefit from a large and very tight-knit collegial group of physician educators who all work closely with each other, but who also take the time to get to know us as well. We're not just a walking pair of scrubs and a name tag to them. These faculty members and clinical educators see us as their future colleagues, and they put in the effort to get to know us and make us feel welcome.
And because of this effort they put into training us and teaching us, I think many of us look to our futures as physicians and are excited about the potential to either return or to stay here in Saskatchewan and work alongside the amazing faculty that have got us to this point so far. I know that I'm very motivated to return to Saskatchewan, not only to serve the population here, but to hopefully give back by teaching medical students at the College of Medicine and hopefully having an impact on them the same way my mentors have had a huge impact on me. From the class of 2021, Sam and myself, we want to say sincerely a big thank you to the faculty for dedicating their time and energy towards building us into strong medical students. And now, physicians, we hope that we can all make you proud as we take the next steps into our careers in medicine.
Last, but certainly not least, we also want to take this opportunity to recognize the absolutely incredible administrative and support staff who have helped us every step of the way, from even before we stepped foot in the college, before orientation, to just a couple days ago. These people work behind the scenes and form the backbone of the College of Medicine, and I truly think it would crumble without them. Thanks to these caring and dedicated individuals, we could trust that our day-to-day activities would run smoothly with very minimal effort on our ends, while we instead focused on learning and caring for our patients. The act of coordinating 100+ students with independent needs, different schedules, and across multiple sites in the province is no easy task. And I don't think I need to explain how the pandemic exponentially complicated that work. So from all of us, again, thank you.
No matter where you're going or what you're doing, congrats everyone, and good luck with this next exciting stage of our careers.
Congrats everyone.
The next person who we are introducing is very special because it is our class valedictorian. So for the occasion, I'm wearing my blazer and look quite professional. And Ben has done you all the favor of doing up his top button. So thank you, Ben. Ben, I thought that since this is such a special person to introduce, that we should probably both have some champagne. Would you like some? Oh, sure. Okay. Get ready, Ben. Oh, wow, it's like magical champagne there. Well, cheers, Ben.
Thanks so much, Hope. This is a lot of champagne and I'm excited to finish it. Delicious. So the valedictorian has actually been kept secret from us. It's in this envelope that I'm now going to pass to my co-MC so that she may open it and we may know who it is. Oh, it's right there. You got it. You got it. You know what? Let's just do this all together.
Oh, it's great to see you, Ben.
And here's that envelope.
Oh, thank you. It's so nice to have you here. All right, well, let's see who our valedictorian is. The moment of truth. I think you and I both know. We both have a suspicion. Of course, it's wonderful
Kate Morrison.
And this is much deserved for Kate. She has been dedicated to supporting and advocating for our classmates since day one. She was our president of the Student Medical Society of Saskatchewan, and she remained really involved in our college during our COVID-19 response. She was previously completing her BSc in Ecological Determinants of Health at McGill University, and she returned home in 2016 to complete her Master of Business Administration at the University of Saskatchewan. She will be starting her family medicine residency in Saskatoon in July and looks forward to serving the people of Saskatchewan throughout her future career. We are very lucky to have Kate here.
Yeah, everyone please give a warm welcome for Kate Morrison. Does it stop? Just stop recording.
Good afternoon, distinguished faculty, administration, colleagues, mentors, family, friends, my fellow graduates, and anyone else who has stumbled upon this link on the internet. It is my distinct honor to provide the valedictorian address for the class of 2021. In preparing for today's address, I did some research and found that its purpose is to express farewell during one of life's transition points. This concept of saying farewell felt particularly salient for this year, since we've all been wanting to say goodbye to this last year for what feels like a while now. But it also felt difficult to properly do this given the unorthodox nature of this year's graduation ceremony. It was within this unorthodox context that I reflected and drew on 3 points that I wanted to share with you today. The first is, things don't always go the way you think they will. Now, of course, you knew this. This is not profound, but stay with me. Certainly, none of us would have thought 4 years ago that we'd be finishing medical school during a global pandemic. Yet, here we are, we've done it. It was just over a year ago that we genuinely were asking each other if we would still be graduating in 2021. But it hasn't just been the global pandemic that has taught us that life doesn't always go the way we think it will. For me, part of this lesson came from a particular patient encounter. The patient had come into the emergency department with a journal of mismatched symptoms she'd been experiencing for the past several months. Playing detective, as we often do in medicine, it was revealed in her workup that the patient had a brain tumor. This was the first person that I ever had to tell, you have a brain tumor. I mentally prepared myself for this prior to going into the patient's curtained off emergency room, predicting emotions of sadness, maybe even anger. But just as life does, this encounter did not go the way I thought it would. The patient's primary emotion when I told her that she had a brain tumor was that of relief. Now, this is something I couldn't have predicted. She explained to me that despite the answer to her question being that of a brain tumor, it allowed her to understand her symptoms, and this gave her a sense of relief. I learned a lot from this patient. Importantly, never to assume that I'll know what a patient is feeling or experiencing. That, of course, was a rookie mistake. So, whether it be in your professional or personal life, when things don't go the way you thought they would, know that this is often those type of moments that life teaches us something new. This phenomenon, to me, is the real lifelong learning that we should endeavor to explore with openness, curiosity, and nurture that opportunity for our own growth. Now, for my second reflection, learning can be messy, confusing, and at times exhausting. This is all a necessary part of the process. Now, think back to our first year. Picture the brand new anatomy lab. Here we undertook some very messy, confusing, and exhausting learning as we endeavored to understand human anatomy. Or second year, when we studied nephrology. Maybe a little less messy, but certainly very confusing and utterly exhausting. We even lost our marbles a bit there when we knew nothing about Alport syndrome. Third year. Recall that semi-lucid headspace you found yourself in around hour 23 of your call shift. You were on obstetrics. You were feeling a bit hazy and had just been called to another delivery. It was indeed messy, certainly very confusing, and you were definitely exhausted. Now, enter fourth year. Or wait, were we still in third year? Some of us on electives, others still finishing core rotations. We had policy emails changing by the minute. And yet, one of the most important questions seemed to be around lighting and houseplants. Would my lighting setup be as good as Alex Sanger's? Is my houseplant perfectly positioned in view of camera to spark interesting conversation should our virtual interview hit a dull moment? We really thought every residency program director loved houseplants. It was all very confusing. If medical school has taught us anything, it's that learning is messy, confusing, and exhausting. I wanted to identify this for all of us today so that we can remember this as we endeavor on our journey of lifelong learning within the medical profession. Just because we've completed medical school and now have our cherished MD behind our name, we all know we have ample learning left to do. So don't shy away from the messiness, confusing, and exhausting learning that is ahead. Instead, dive in, get messy, ask questions when things are confusing, and know that the journey of lifelong learning is one that has no prescribed end date. So it's okay to pace yourself and at times feel exhausted. But if you stay interested and let the learning fuel your passion for the work you do, there will be no holding you back from the positive impact that you will have on your patients in the medical field. My third and final point. As physicians, we are situated within our communities to provide trusted, evidence-based information and challenge inequities and injustices that threaten our communities. This responsibility must not be taken lightly. The COVID-19 pandemic has demonstrated the need for physician voices and leadership in times of community crisis. It has also highlighted the many inequities and injustices that exist within our healthcare system and our society, all of which threaten the collective health of our communities. Our role as physicians extends beyond the walls of our hospitals and clinics. It is imperative that we all take on active roles within our communities to utilize that privilege and the trust that comes with being a physician. I've had the pleasure of getting to know members of our graduating class today over the past 4 years, and I feel confident that if each of us take on this responsibility in earnest, our impact on the culture of medicine and societal health will be substantive. In closing, life will not always go the way we think it will. Learn from those moments. As you learn, remember it'll be messy, confusing, and at times exhausting, but dive in and have fun. And lastly, as you go forth as a newly minted physician today, remember that the responsibility you have to yourself, your profession, and your community extends far beyond the hospital and clinic walls. It has been an absolute honor to train alongside each of you. I hope you all have lots of fun as you transition into this new phase of your career. Congratulations, everyone, and thank you.
That's all, folks. Thank you so much for coming. We wanted to give a big shout out to the grad committee for putting this together, for all the IT and technical support that we had in this kind of laborious process, and each and every one of the speakers that came out today.
Yeah, and thank you to all of you who tuned in today. And of course, thank you to our classmates and fellow graduates for the last 4 years, because it has certainly been a blast. And congratulations, enjoy the celebrations, and the best of luck in the start of residency.